Good afternoon. My name is Rick Hendricks. I'm the State Records Administrator at the State Record Center and Archives in Santa Fe, New Mexico. I would like to thank the Albuquerque Historical Society for giving me the opportunity to speak to you folks today. All of you know that we're in the midst of a pandemic, and the governor has issued a new health order, and we'll be in shelter in place for the next 2 weeks. And so I think that that's going to make today's topic particularly timeful. I'm going to talk to you about the Spanish flu pandemic of 1918. This presentation will be with a oral presentation and a screen share. And I would just like to mention that if you like New Mexico history, I would invite you to check out State Historian Rob Martinez's New Mexico History in 10 Minutes and our website, newmexicohistory.org. Okay, so I'm going to start the screen share for you folks. Okay, so we're going to be talking today about La Gripe, the Spanish flu pandemic in New Mexico. Start with a little poem that was in the Santa Fe paper. I had a little bird, its name was Enza. I opened the window and influenza. Children's rhyme during 1918. These types of things were fairly common in newspapers really all around the world. Those of us who are experiencing our first pandemic, and that would include almost all of us, know we talk about pandemics coming in waves, and the Spanish flu came in 3 distinct waves. The first wave was in spring of 1918, and in contrast to a typical flu, which would look like the highest risk would be to the sick and the elderly. The Spanish flu attacked younger, healthier people who would typically recover from a flu more easily. Physicians, particularly in New Mexico, were on the lookout for high fever and runny nose as being telltale symptoms that a patient had Spanish flu. Obviously, there are many other symptoms, but those were the ones they tended to focus in on. This is Camp Funston in Fort Riley, Kansas, where generally speaking, the first case in the United States was said to have happened in March. Some people say as early as the 4th of March, but more typically the 11th of March of 1918. And of course, it ran through the camp very quickly. The soldiers were living in very close proximity and spread the disease very rapidly. The second wave was the fall of 1918, and this wave really went all around the world, and this was by far a deadlier wave. A lot of what I'm going to talk about today, including how the pandemic affected New Mexico, is going to be related to World War I. World War I was a spreader event for the pandemic. And one of the things that was typical of what happened was that mildly ill soldiers remained at the front, thinking that they could keep fighting, and the severely ill went to hospitals. And what that tended to do was then spread it in the hospitals very rapidly. Another thing that was causing a problem was that one of the early treatments was with aspirin. And some of the people in the hospitals were suffering from aspirin poisoning, which caused hyperventilation in 33% of the patients and lung edema in 3% of the patients. So in trying to treat the disease, they were often making it worse. The third wave was the winter of 1918. And if you look at this chart, you can see the mortality wave. It really is truly a wave in the sense of rising and falling rapidly. You can see over this period of over time how that dramatic wave, I mean, if you compare that to what we're seeing with the pandemic here in New Mexico, the COVID-19, we're not seeing so much of a wave as almost a constant increase now. It doesn't really have this wave pattern. So what was it like to have the Spanish flu? Well, you'd start out with symptoms of ordinary flu: fever, chills, muscle aches, cough, congestion, runny nose, headaches, fatigue. But then that was followed often by a rapid onset of pneumonia, and frequently the cause of death that would be listed would be pneumonia as opposed to influenza. One of the things that was characteristic of Spanish flu was cyanosis. The lungs would fill with fluid and it would displace the oxygen. And people would have mahogany or purple spots on the fingernails, the cheekbones, the ears, and the face. And then that would be rapidly followed by death. And here's a picture of cyanosis on the hand. You can see sort of a purplish tinge to the fingers. This was very characteristic of people who had the Spanish flu. And this is a picture, not for the faint of heart. This is a lung, and you can see how damaged that lung looks from the impact of the illness. Well, one of the big questions was, what was the source? And over the decades, there have been lots of sources proposed. And if you see this chart, you can see a number of them. The Annam Kingdom, which would have been Vietnam, Laos, and Cambodia. There were soldiers from this area that were serving in France in 1916. In the United States, we tend to point to Camp Funston at Fort Riley, Kansas. There were a lot of poultry farms in the area. And since we now know that there was an avian component to that flu, that's one of the reasons that that's suspected. There were also Chinese laborers working there in March of 1918, which is in fact when the first cases showed up. Shanxi province of China, another possible origin area. It broke out there in 1917. Boston on the east coast of the United States and Brest in France. There were 96,000 workers on the docks there in France. Another place in France, Étaples, is a place that is often cited as maybe one of the logical sources because there were 100,000 soldiers moving through there a day. There were a lot of piggeries and poultry farms in the area. Austria also possibly had an outbreak in 1917, and New York had an early one. So you can see that there are a lot of different places, and curiously enough, in this list, we don't see Spain. Now in Spain, this particular influenza had a number of names, none of which was Spanish flu. El Soldado de Nápoles was a song from Canción del Olvido de José Serrano Zarzuela that was very popular in Madrid at the time, and that was a euphemism for this flu. They called it La Enfermedad de Moda, the popular illness. La Dama Española, the Spanish lady. These were all terms that were used to describe the flu, euphemisms for the flu, if you will. One of the reasons that the name Spanish flu has attached to this pandemic was because the Spanish press was not censored. And the Spanish royal family suffered from the flu, whereas the other European powers were censored because they thought that morale would decline if they reported deaths among the soldiers. And so it was in the press more frequently in Spain, more openly reported. And as you can see from these figures, Spain did have early cases. These are fatalities, 147,114 in 1918, and then declining as the years went by, a total of probably more than 260,000 victims. So although it couldn't have originated in Spain, it certainly did impact Spain. Again, the place in the United States where we associate the first outbreak is Camp Funston in Fort Riley, Kansas. This was a place where people were who had been serving overseas came, and also people who hadn't been serving overseas. And interestingly enough, one of the very first victims in that first batch of victims was Raymond C. Bloom. Many of you will know of the Bloom family in New Mexico, important family of historians, outstanding scholars. Anyway, Raymond died in the 22nd of March there. He was in officer training school, and this would have made New Mexico among the first victims of Spanish flu. We had in this state a number of camps where people were training to go overseas. And one of them was Camp Cody, which was located in Deming, New Mexico. And here are some images from Camp Cody in that period. The first soldier that we know of who died, and typically this is said to be the first case in New Mexico, was a soldier who had arrived on the train from Camp Dix, now Fort Dix, New Jersey. He arrived on the 24th of September, 1918, and died on October the 1st. And there were almost immediately multiple cases, and the epidemic was said to begin with 9 cases that day, and it spread very, very rapidly. 2 doctors, Captain Frederick Howell Lamb, who was the chief of laboratory service at Camp Cody, and Lieutenant Edward Bacon Brannon, published the first data-driven research on the influenza that was attacking the soldiers in Camp Cody. And their work was very pioneering and very important early work on that. There's another picture of the nurses there at the hospital. And of course, Camp Cody became a place for soldiers who were ill, of course, as well. And here, soldiers suffering and here's some stats from Camp Cody. From October 1st to December 1st, 1918, 3,265 admissions. On the 26th of October, 378 alone. The 30th of October, there were 2,153 patients, 1,899 suffering from influenza or pneumonia. They had already exceeded the capacity of the beds. Of course, this is something that we're starting to see in this country, in our region. I'm sure many of you know that El Paso has exceeded capacity at many of their facilities. Death in 7.3% of the cases, of all cases, and 38.4% of pneumonias. So the influenza and the pneumonia together were highly lethal. Many of the New Mexicans who died in the military. This is a typical New Mexico military flu victim abroad, and we're very fortunate to have here at the State Record Center and Archives a wonderful data set of questionnaires that were collected in the aftermath of World War I, and those questionnaires provide valuable information about the cause of death of many. And I've just selected one because it was This is Elmer Roy Adair, who was wounded in an air raid in France and hospitalized, and he died of influenza there in August of 1918. This was a fairly typical occurrence because it was Spanish flu was spreading so rapidly in the hospital setting. Many New Mexicans also died stateside. They were in camps. This is an individual who died, Roger Longbotham, not a very New Mexico sounding name, but nevertheless from the Penasco Valley. He died at Camp Dix. Many of them who succumbed never made it to overseas. Now, here are some places where New Mexican soldiers died from influenza. Camp Cody, we've already mentioned. Camp Dix was a place where a fairly high number died, and Camp Mills was another place. But you can see that New Mexicans that were serving in the military and were in camps literally all over the country died from influenza. There were also New Mexicans who died aboard ship on the way to or from Europe, and others who died in France and Germany. In total, 127 soldiers died from New Mexico soldiers died, 22 at Camp Dix, 13 at Camp Mills. There were 3 sailors, and in the American Expeditionary Force, those were the soldiers who were fighting in Europe. 63 New Mexicans died from Spanish flu. And this is just an image of Fort Bayard, which was another facility in New Mexico, in southwestern New Mexico. Private Corny Gill arrived from Ellis Island on the 20th of September. He died. There were 287 patients and 115 staff that contracted flu. We also had Fort Stanton. Fort Stanton had tubercular patients. Their immune systems were already weak because of tuberculosis, and 149 out of 300 tuberculosis patients died. And you can see a very high mortality of 18%. And here's Fort Stanton today and a Fort Stanton ward during the time of the pandemic. Look at a few New Mexico cities. Carlsbad was one of the early cities that reported Spanish flu in 1918. Some people said that it had come with circus performers on the train. It's possible, if you're patient enough and willing to read the newspaper, that you can track many New Mexicans name by name. This is 33-year-old Myrtle Poor Gurley from Clovis, who died in September, 7th of October, 1918, which is a very early one. And Deming possibly had the earliest civilian death on the 27th. In Gallup, much as we've seen with the COVID-19 pandemic, and this has to do with, in many cases, the way in which the Navajo people live in multi-generational homes. There were many Navajos, perhaps as many as 4,000. The reason this figure has a question mark is that it's very much up in the air how many Navajo people might have died. And there has been a study going on at the University of Arizona that's looked at Navajo fatalities in that period, 1918, 1920, both in Arizona and New Mexico. And they're looking at all sorts of records to try to see if they can determine how many there might have been, but it seems to have been very high. And there's anecdotal evidence in the newspaper. You'll see references to things where it'll say that Native peoples are dropping like flies. Much as today, the newspapers were filled with stories of the pandemic. It was quite common to see calls for nurses. This would begin in 1918 and ran for several years. Again, much as today, The nurses fighting the pandemic were exhausted, and there were never enough. One of the things that I found interesting also in the paper is that the mostly young women who were the telephone operators, many of them were young, and they were falling victim to influenza, and it made it very difficult for phone service to be handled. So the Mountain States Telephone and Telegraph Company put out a notice asking people not to make unnecessary phone calls. Communities around New Mexico, different communities took different approaches. This is from Roswell. This is from October the 5th of 1918, and this is a notice, an order from the Board of Health from the city of Roswell. And it's basically saying that there's a prohibition on congregating in public places, and it lists that it's unlawful for picture shows, dances, schools, parties, pool halls, Sunday school, churches, lodges, and basically any place where people would congregate. And interestingly, there is an order that the police are to enforce the ordinance. Now, I don't have any evidence of how that enforcement might or might not have taken place. The Spanish flu, if a lot of what you read is that it was a sort of an equal opportunity killer, but it really wasn't. Indian native peoples and Mexican Americans in New Mexico were especially vulnerable. This has a lot to do with socioeconomic conditions, but again, I mentioned the Navajo, but other native peoples as well. In northern Mexico, there were as many as 500,000 deaths, and many people in northern Mexico at this time were crossing over into the United States to work, and they tended to be in Doña Ana County, and they lived in overcrowding living conditions, and they were young, and they were in the prime of life, which also made them the prime age to be a victim of Spanish flu. I'll mention just two communities that I've looked at. San Ildefonso had a mortality of 40%, which is a completely staggering number. There are almost no records of the burials or the deaths of these people, and I've suspected that the Catholic priests that were supposed to be serving there were afraid to go into the Pueblo, so there's really only one recorded sacramental record of a death there for San Ildefonso Pueblo. One curiosity is that the artist Crescencio Martinez, who died in June of 1918 at the age of 28, which would be a very typical age to have died from Spanish flu, is generally said to have died from that influenza. And if that were true, June of 1918 would certainly make him the earliest person in New Mexico. And I've often wondered, since he was an artist and was in Santa Fe frequently, if there's some way he possibly could have contracted it, or whether it's just if time gone by, it's just his death is associated with Spanish flu. And then, of course, we've already mentioned the Navajo. You could have tragedy or good fortune in a community in New Mexico, and some of it seems to have had to do with luck, and some of it had to do with how a community responded. I've got just a few examples here. Artesia at one point had a caseload of 200, which represented 12.5% of the population, but out of that, they only had 2 deaths. This was just one slice of time. Now, the father of a colleague of mine reports that his grandmother frequently visited communities in the Chama drainage north of Española, and I'm thinking here of places like Hernandez, El Huache, El Duende, those little communities. And apparently, in some cases, entire families would die. And so we don't really have very good records on this. Dawson, the mining community, 79 deaths out of a population of 6,000, 13.2% for 1,000. if you know your geography of the southern part of the state, that you know Mesilla and Las Cruces are very close to each other. Mesilla reported many deaths and Las Cruces reported few deaths, even given their proximity. So some of it may have been a little bit of luck. Now, Albuquerque was very effective in dealing with Spanish flu. The numbers vary, but just to give you an idea, of 923 cases and 167 deaths, part of the reasons that they were effective and they had so few is they put out, the city commission put out a series of orders that had to be followed. Funerals were to be private. They banned all public meetings, both indoor and outdoor. And that included religious services, concerts, lodge meetings. And again, as in the case with Roswell, violators were subject to arrest. Of course, schools all through New Mexico were closed. In Albuquerque, they identified quarantine homes by putting up signs, and these were placed by the city health official, and they could not be removed by private citizens. A lot of people had taken to fumigating their homes. That was prohibited and could only be done by city officials. And city residents were asked not to violate the spirit of restrictions by going outside the city to the county to do all the things that they were not allowed to do in the city limits. So these measures were very effective, and there were articles in the newspaper. Obviously, people protested just as they protest today about the restrictions that are placed on them. And the city of Albuquerque cited Denver, which had put on very similar restrictions and then lifted them and suddenly had an outbreak as a reason to keep them on. And they stayed on in Albuquerque for a long time. Physicians in Albuquerque were required, they were to require symptomatic patients to stay at home. And if they had a cold, if they had a runny nose, that was symptomatic enough to order to be stayed at home. They were required to report influenza cases to the city physician, and they were required to order patients to remain at home for 3 days after their temperature had returned to normal. So these were measures that were all in place in Albuquerque. There were also in the paper some very helpful tips. Don't worry, don't kiss, don't overeat, don't go out feeling ill, keep away from crowds, breathe deeply through your nose, keep your feet warm and dry, sleep 9 hours at least, do not cough or sneeze at anyone, expectorate in paper and burn it up, keep your head cool, your feet warm, and your bowels open, and don't be sneezed at. These were, I'm sure, highly effective. We don't see anything in there about wearing the mask, although we do know that masks were worn. And so what the two methods that were most effective all over the United States where they were done were what was called protective sequestration, which was the idea of protecting healthy people from contracting infectious disease. And so the idea was to keep healthy people away from people who were ill, and then quarantine, which was to segregate people who were ill to prevent spreading the disease. Those two simple measures were very effective when they were practiced. Since Isleta Pueblo is very close to Albuquerque, I thought I might share this with you. I've looked into Isleta Pueblo in great detail in a number of areas, but including the pandemic. And one thing I wanted to note was that one of the things that makes it very difficult for us to really understand the impact and to get numbers in New Mexico is because health in general and public health in New Mexico was very poor. In November of 1918, the Indian agent Lonergan reported 8 or 9 deaths a day in Isleta Pueblo. So I've looked at every burial record and every death certificate available from any source, and there was never a period when 8 or 9 people a day were dying day after day. There were 9 people who died over a period of a few days in October of 1918. But from October to December of 1918, there were 17 deaths of all causes, 10 of which could probably be attributed to the Spanish flu. In 1918, there were 17 deaths of all causes, one of which was attributed to Spanish flu. And in 1920, when in most places the pandemic had waned, there were 40 deaths of all causes, 9 of which were Spanish flu. Now, the causes of death were everything you can imagine in a community at that time when the overall health was not all that good. Children died in childbirth, mothers died in childbirth, kids had whooping cough, people died of cancer. In the Pueblo, they say that there were so many people that died of Spanish flu that they had to relocate the cemetery. And so what I'm suspecting is that a lot of the things that were ascribed to Spanish flu were probably cases of comorbidity. People had other illnesses and their immune system were weakened. And so they did in fact contract the flu. But this kind of anecdotal information, when you compare it with the information, the hard data that we can find, makes it really difficult to determine how many people were actually dying from, the flu alone. Here are some New Mexico statistics. Governor Lindsay did his very best to collect statistics. And by November 1st, 1918, 15,253 were ill and more than 1,035 dead. So you can find almost anywhere stories that will say that the number of people who died in New Mexico ranged from 1,000 to 5,000. Well, we have pretty hard data that there were more than 1,000 in the first year, so it's not likely that the lower number is accurate. The population of New Mexico was 350,000. I'm more comfortable with 5,000 deaths. That may be an exaggeration, but that's 1.4%. I've already said that young people died more than younger people in the prime of life. So say from age 20 to maybe 50 or 45. It's always been an interesting question why so many died. They died typically from rapidly progressive respiratory failure and through a cytokine storm, which is an overreaction of the body's immune system. Cytokines are proteins and glycoproteins that are produced by certain immune cells. And when they go to a site where the body's being attacked in too great a number, the virus can stimulate so many antibodies and that it actually, people tend to drown. Their lungs fill and the victims choke to death. And so one of the ideas is that younger people had very strong immune systems. And so in many cases, their immune system overreacted. If you have listened to reports from hospitals about COVID-19, they have talked about cytokine storms happening. So this reaction of younger people, overreaction to the invasion of the body by the virus is happening with COVID-19. And I found that to be quite interesting when I first heard that, and my ears sort of pricked up when I heard that. Another cause that made it so deadly in New Mexico was there was a lot of malnutrition, poor hygiene, and generally poor sanitation, which brings up the idea of comorbidity. People were in not good health, and it is even in death certificates from 1918, 1919, 1920, you often see the comorbidity causes will be listed. It'll say It'll list influenza, and it'll list several other conditions that the physician felt like were contributing to it. It was an existing human influenza A subtype H1N1 virus. When you hear H1N1, that'll be familiar to you because it's a virus that we still have. The Spanish flu acquired genetic material from an avian flu virus, and this new H1N1 strain was able to invade immune systems, evade immune systems that had no immunity. So people who were born between 1880 and 1900 had been exposed during childhood to an H3N8 subtype flu virus that had been circulating in 1889, but they had no antibodies to fight an H1 virus. So if you can see this little chart here, you'll see the pandemic death rate in various age groups, and you see it's pretty steep, and the peak is 28 years old, which we would really consider typically to be someone who was definitely in the prime of life and should be able to fight off an illness, and would have been able to fight off many varieties of flu, but no real immunity to this one. New Mexico had no statewide board of health department. We had a board of health that could, and it had the authority to order quarantine, to order investigation, to appoint health inspectors. And one of its most effective tactics was try to convince and complain. There were county health officers, but many counties in New Mexico had no resident physician at all. The United States Public Health Service sent out Dr. John W. Kerr to survey public health administration in New Mexico, and he arrived at a timely moment on the 18th of September of 1918. And he reports on public health and influenza in New Mexico. And interestingly enough, one of the places that he went, because he arrived in Albuquerque, he went down to Isleta Pueblo and he commented on what he was observing there. The 1918 primaries for governor, both the Republican and Democratic Party had public planks that would have a statewide health department to be created. Governor Octaviano Larasolo was elected, and in his inaugural address and his address to the legislature, he spoke about the need to create a Department of Health. And House Bill 118, which was introduced, in fact, did create that in 1919. The statewide Board of Health had Superior Health Authority. The first one was a three-person board: Adelina Otero Warren, Dr. Oliver Hyde, and then a civilian was to be appointed. By really just a year later, by 1920, we had divisions of vital statistics, preventable diseases, sanitary engineering and sanitation, public health education, public health nursing, child hygiene, laboratories, tuberculosis. So well on our way to having a modern health department. I want to speak just a little bit about virology and the Spanish flu. Most of you will know what all this is, but it's interesting to understand the nature of the illness. A virus is a small infectious agent that replicates inside living cells of other organisms. And influenza is an infectious disease that's caused by an influenza virus. There are three types, A, B, and C, that affect humans. H1N1 is an A, influenza A. some of the pioneers in research on viruses, Dmitry Ivanovsky did work with the tobacco mosaic virus disease, which is a virus. And some of you probably are aware that one of the vaccines that is being developed now is a plant-based vaccine, and they're using the tobacco plant. So it's quite interesting that some of the pioneer work in virology was done with tobacco, and here some of the cutting edge research that may produce a vaccine, a plant-based vaccine, is also being done with tobacco. Here towards the end of the 19th century, they're starting to determine that there's a new form of infectious agent, and they give it the name virus. The first influenza virus was isolated in poultry in 1901. And you can see that it's not until a good bit after Spanish flu, not until 1931, is virus as a cause of influenza in other animals recognized, and then it's isolated from humans in 1933. So long after. And then there has been a search that's been going on almost ever since then for the actual virus of the actual strain of Spanish flu. Other pandemics, H2N8, the Asiatic or Russian flu, that was the one I referenced that provided some immunity to people of a certain age. The H1N1 Spanish flu, 1918, and also swine flu in 2009. An H2N2 Asian flu in 1957. H3N2 Hong Kong flu in 1968, and H5N1 bird flu in 2004. So you can see that other pandemics have happened. And I know that when I've given talks on Spanish flu in years past, I always used to conclude my talk saying that epidemiologists have always said that there will be another one. It's not a question of if, it's just a question of when. And of course, as I would say that at the end of every lecture, I never really expected that I would be living through one, but it's quite interesting for someone who's studied it from a historical perspective. So what have we learned? Well, we've learned that Spanish flu was not Spanish at all. We've learned that it was more deadly than World War I. Estimates range from 50 to 100 million worldwide. Now, most of the estimates tend to be closer to 50 million than 100 million. But those are what's out there. 650,000 to 700,000 in the US, maybe as many as 5,000 or more in New Mexico. Just to give you some perspective, the war killed 10 million soldiers and 7 million civilians. So even if we go with the 50 million worldwide, still many more victims of Spanish flu than World War I, which was, as you know, considered to be the war to end all wars. Very likely late arriving in New Mexico. Had a devastating impact here. It decimated many small rural communities. It was not an equal opportunity killer. It was especially lethal for those in the prime of life. As you saw from that chart, 28 would have been a really difficult age to be that time. There were socioeconomic disparities. It was disastrous for Native Americans and Mexican Americans, and it contributed to the establishment of the Department of Health in New Mexico. Now, I am going to stop, and I believe we are going to have the possibility of questions if someone has any. Maybe no one was in attendance. So there is a question about the treatment protocol. The treatment protocol was basically what we would do to treat flu in the absence of something like Tamiflu, that type of thing. In other words, there was no real treatment. So it was nothing really scientific. People were supposed to, I think I read a few of those things. You were supposed to eat well. You were supposed to get plenty of rest. Those sort of a chicken soup approach. There really wasn't anything. There was no particular medicine. Of course, vaccines were being worked on, but nobody really understood a vaccine that would do for a virus. So there were articles in the paper saying that people were trying to develop vaccines, but they didn't think they would be effective. So, I mean, the kind of things that people would do would be, again, bed rest, plenty of liquids, those types of things. But there really wasn't anything, there was no medicine that was available. So. I mean, the doctors at Camp Cody developed a protocol, but again, it wasn't really anything particularly scientific. The question was asked, did the Albuquerque hospitals ever get overwhelmed? And no, they didn't really ever get overwhelmed. I have not seen any evidence for, there's a question about masks in the Southwest for the flu. I have not seen any images of masks in the Southwest. There are most of the ones that you see tend to be in other parts of the country. There are some from Boston and some from Seattle and various places, but I've looked and I haven't. If anybody out there has them, I would love to have an image of somewhere in the Southwest. I know that there were the same sort of campaigns to wear masks, and people would come up with little jingles, little poems to help people remember to wear their masks. And there were also anti-mask campaigns. So don't know about New Mexico or the Southwest, but why? And there's a question, why was it not documented so much in newspapers in the general media? Well, what tended to be in the newspapers would be stories of individual New Mexicans who would die. So if a prominent individual died, there would be a little story about that person having died or that person having survived a battle with influenza. But the stories were often taken from other newspapers around the country or around the world. And so there weren't all that many sort of general stories about New Mexico. The stories tended to be, of course, there was also a war on, and that was one of the main focuses of what would be in the newspaper was what was going on in the war. So I guess you could say that it was competing with the war. There's a question, were people resistant to the vaccines when they came out? Well, in reference to the flu, there weren't any vaccines that came out until far long after. So I don't really know. I mean, there weren't any vaccines that were for Spanish flu, and so. And somebody asked the question, what finally ended the pandemic? The pandemic, I would imagine, was ended by herd immunity would be the most likely reason that it died out, I suppose, or it mutated. Most viruses mutate, and they tend to mutate away from being lethal. And this particular strain may have done that. The strain that was the Spanish flu, which is a kind of H1N1 with some avian flu characteristics added to it, had disappeared for a very, very long time. It was only in the 20th century when it was recovered, and it was recovered from frozen bodies in Arctic region. And the University of Washington, since about 2004, their microbiologists have been working on trying to understand everything about it. Someone said, did this affect the treatment for TB later? And I'm not sure if I completely understand that question. If the Spanish flu affected the treatment for TB, I don't really know the answer to that, to be honest with you. There's a question about how curanderos responded to this. Well, a lot of the anecdotal information that's out there that you get from New Mexicans whose grandparents or great-grandparents lived through this period talk about how people who may or may not have been officially curanderos were definitely involved in many communities. There was a woman in Pecos who was very involved with ministering to to the people who were ill. And as I mentioned, the woman that was in the Chama drainage, who would go around and take food to people. And I imagine that there was a big response because, as I said, many of the counties in New Mexico did not have a physician, and there was a shortage of nurses. Did this affect poultry raising? Well, I don't know that there was a direct connection to the raising of poultry, but poultry was certainly cited both in Europe and in the United States as being problematic, having poultry farms and the waste in close proximity to things like army camps and that kind of thing. And of course, poultry raising has changed a lot since 1918. Question says, I read in a book about pandemics that it was so traumatic that the president and others just wanted not to discuss it. Didn't Wilson get the flu and die later? Well, I'm not sure it was just because it was so traumatic, but there is no question that the government, both the US government and the European governments involved in the war, tried to, I hate to say it this way because it's going to sound like I'm echoing what's going on today, but to downplay it because there was a great concern that morale of the people would be adversely affected as the war was going on. Wilson did get the flu. He did, as far as I know, he didn't die from the flu. And yes, we all know that he did die later. Okay. I don't believe there are any more questions. I appreciate some of those because I always appreciate questions I can't answer. It gives me something to go look up. Once again, I'd like to thank the Albuquerque Historical Society for giving me this opportunity to share this information with you. I hope you will check out their future programs and have a good afternoon, and everybody be safe.